Hello everyone, welcome to Apollo Spectra Hospitals, Kormagla, Bangalore. We have with us Dr. Sampath Chandra, who is specialist in ENT and skull-based surgeon. Today's topic for the FB Live will be uses of cochlear implant and what exactly is cochlear implant. Over to you, sir.
Hello everybody, my name is Dr. Sampath Chandra Prasad Rao. I am a trained skull-based surgeon and a cochlear implant surgeon. So, cochlear implantation is a very special technology that brings back hearing to potentially deaf people and what we call sensorineural deaf people. Now, deafness originates in the ear, and when I say deafness, I mean that a person is unable to hear properly. And when we speak about deafness, there are two types of deafness. One is what is called a conductive deafness, and the other kind of deafness is called sensorineural deafness. Now, to understand these two concepts, one needs to understand the anatomy of the ear and how the ear is structured. The ear essentially has three parts: the outer ear, middle ear, and the inner ear. Any defect in the outer ear, that is the area that we see, and there's this hole that we see around the ear, inside the ear, so that's the outer ear. There is a tympanic membrane that separates the outer ear from the middle ear, which is a box-shaped structure containing a bridge of three small bones. The three small bones then connect the tympanic membrane to the inner ear. The inner ear is a very strange and sophisticated structure that is shaped in the form of a snail. And it's got 2.5 turns, and it's also got 3 rings attached to it which maintain the balance apart from hearing. So the inner ear is a very complicated structure that maintains both hearing and balance. Now, any problem in the outer ear and the inner ear gives rise to what is called conductive deafness. Conductive deafness happens when there is a perforation of the tympanic membrane, when there is an infection in the middle ear, or when there are damages to the ossicles. There is no nerve involvement. But if there is a problem in the inner ear, that leads to neural deafness, which is rather difficult to set right. Nerve problems anywhere in the body are difficult to restitute. So, the problem for which cochlear implant is a solution is for sensorineural deafness or inner ear related deafness, not the deafness originating from the outer ear and the middle ear, which is more easily treatable by medicines or by surgery. Now, the inner ear deafness is more or less permanent, and even if there is a partial inner ear deafness, what we call sensorineural deafness, and I am going to use that term more often, then sensorineural deafness can either be progressive or it is irreversible. It cannot be brought back, especially if it's a long-standing sensorineural deafness. Now, sensorineural deafness can be of two types. One is it can be congenital, that is during birth, or it can be acquired, that is due to an infection that affects the inner ear, which can lead to a permanent deafness. One of the only ways to restore sensorineural hearing loss, which is again inner ear deafness, neural deafness, nerve deafness, is by cochlear implantation. Cochlear implantation is a solution that is provided to people in many cases, a large number of cases, children or newly born infants that are born deaf. So when we talk about cochlear implantation, we are talking about surgery. But before I go into surgery of cochlear implantation, I need to explain or bring to the forefront some dynamics and some statistics that will make you understand the magnitude of the problem of deafness in our country. There are more than 6 crore deaf people in India, and that's a huge number by any standards. Most of these people are what we call moderate or severely or profoundly deaf people. A large section of these people are newborn children, and a large segment of surgeries that I do for cochlear implants that I do is on small children who are 1-year-old, 2-year-old, and thereon. Now, when these children are born deaf, they do not perceive any sound after birth. Now, the problem with sensorineural deafness and deafness related to the nerves is that when a child is born deaf, also does not hear its own voice. This leads to a situation where the child does not recognize or realize the fact that it has voice, it is able to speak, or it is able to communicate. Eventually this leads to a situation where after a few years the language and speech of a child also undergoes deterioration to the extent that the child remains mute. So children that are born deaf end up becoming mute as well, and that is why they are called deaf and mute children when they grow up. Now cochlear implantation, if it is done early through a surgical procedure, then this not only can sound be restituted, or the child can not only hear, the child can also eventually be able to speak. This is very important. Now cochlear implantation, as I told you, involves surgery. We are talking about two components. One of the components is put behind the ear, in an incision made behind the ear during surgery, and the implant is fixed under the skin, attached to the bone. It is drilled to the bone. So that is the implant which remains under the skin permanently. There is another component called the processor. So the processor then is fitted over the skin after the skin heals after surgery, and then the processor is able to communicate with the implant, and the child is able to hear, or the deaf person is able to hear. So as I told you, deafness can occur in the adults as well due to infection, or due to what we call sudden sensory neural deafness, or even due to some tumors. So whenever there is an opportunity to implant a child, one needs to understand that this implantation should be done as soon as possible. Now there is a component called brain plasticity. Brain plasticity means that if sound does not go into the brain, that area of the brain which is designated for hearing, so this part of the brain undergoes change wherein the neighboring parts of the brain eat up and they use the part which is meant for hearing. So this process of brain plasticity starts immediately after birth and goes up to about 5 years. So if a cochlear implantation is put after 5 years, it again becomes useless, because even if the implant works and everything is set for hearing, the brain does not process it, because it does not have an area for processing, because the hearing area has been eaten up by the neighboring areas for, let's say, for speech, or for for the eyesight, or for any other part of the body. So it's very important that cochlear implantation is done as early as possible. I have been part of a implant which was done even at 6 months old. So the youngest I have implanted is approximately 1 year old. So the earlier the child is implanted, the better it is for the child, because the child then grows up practically as a normal child. But if the child is implanted closer to 5 years, 6 years and thereon, the effect of cochlear implantation deteriorates due to the fact that the brain does not have an area to process the sound coming in from the ear. So having said this, my message to the community is to identify deafness. We are a part of what is called Shravanadosha Mukta Karnataka, or deafness free Karnataka, or deafness free community, where we pick up these deafnesses as early as possible. This should begin with what is called newborn screening program. When a child is born, the child is these days, a lot of anomalies are tested even before birth. Prenatal scannings rule out a lot of anomalies, but at the same time it's very important for the lady who has delivered, or the family that has got the gift of a child, to be able to to be able to provide a newborn screening for the child. So the child is generally in good hospitals. This screening is done as soon as the child is born, and if there is a hearing defect, then this has to be taken care of by what is called a cochlear implantation. Now the implantation itself is a surgical process, as I told you. It is a rather expensive procedure, because the implant comes from overseas. It comes from other countries outside India. So these are not the cheapest of devices, and it requires the family to be able to provide considerable financial support, not only during the time of implant but thereafter, in terms of AVT sessions and other audiological evaluation procedures that are done after surgery. Now, staying on the subject of what happens after implantation. Once the surgery is done and the implant is put on to a person or a child, after 3 weeks we do what is called a mapping and a switch on. So once the switch on is done, the child will be able to hear. But the child, remember, is not used to hearing. For this child, this whole process of hearing is something new. So it's not as if when a switch on happens, all problems are sorted out and the child begins to hear and the next day the child begins to speak. No. So this process takes some time. So when we initiate the switch on of an implant, we hand over the child to our speech and audiology team. At Apollo Spectra and Bangalore Hearing and Implant Institute, we have a brilliant speech and language team and audiology team that takes care of the child and handholds the child into hearing and thereby speech development. This whole process takes 1 year. So it's very important for the family to remain strong and be with the child even after the implantation, and teach the child how to make use of the hearing that is now established, and thereby convert it into speech and thereby to language. So cochlear implantation is a wonderful technique and a wonderful device or a procedure that brings back not only hearing but also speech, and thereby provides the child a new leash of life, without which the child would have probably been condemned to being a second-class citizen in our society. So I request everybody in the community to kindly identify deafness very early and support the deaf community. And for the more fortunate of us, we should also form a society that is able to take care of the deaf people and use our finances and use our good offices to promote donation programs for the needy people who cannot afford cochlear implantation. Thank you.
Thank you, sir, for your inputs. May I ask few questions? What is the earliest age for cochlear implant? Can it be done at any point of time in a person's life?
Cochlear implantations can be done very early. As I told you, I have been a part of an implant that was done at 6 months of age, and the earliest I have implanted is about 1 year of age. So I always counsel my patients saying that the earlier the better for a cochlear implantation. Now again, re-emphasizing on the issue of brain plasticity, the brain has an area for hearing which, if it is not stimulated in the first few years of its life, of the child's life, this area can be used up by other parts of the brain, which will then mean that even after putting a cochlear implantation, the child would then not be able to hear. So hear well enough as well as it would have been if the implantation was done very early. So the ideal age for implantation is between 1 and 5 years, 5 years being at the upper end of the spectrum, where the brain plasticity would have already started. And if the implantation is done after 7, 8, 9 years, the results obviously go down. The results are excellent in our children who have been implanted between 1 and 2 years. And I would say that the earlier is always better for cochlear implantation.
Is cochlear implantation viable for entire lifetime?
Once the implant is put under the skin and fixed to the bone, that part, what we call the implant, which has the electrode and it's got a receiver stimulator complex, this remains under the skin for the rest of the person's life. The processor, which is essentially a magnetic device which sticks onto the implant which is under the skin, can be changed, and this is a battery operated device which has to be charged using rechargeable batteries. Yes, to answer your question in one line, the implant once done is for the rest of the life of the person undergoing implantation.
Is it safe to use implantation during CT procedures or MRI?
Cochlear implantation has a magnet. The implantable device has a magnet which obviously attracts the processor. Now this magnet is CT compatible but not MRI compatible, which means that the magnet will cast a shadow, because the MRI, the full form of MRI is magnetic resonance imaging, which means that there is a magnet in the MRI machine as well. So when there are two magnets, it casts what is called an artifact or a shadow over the area around the magnet. Now when we implant a child, we know that a child grows healthily unless there is a need to undergo a MRI. Most situations are tackled by a CT scan. Now there are tumoral situations which would require an MRI. So in such situations, there are two solutions to this problem. There are certain companies which have magnets which align themselves according to the machine, and that means that the implant is MRI safe. There are other companies where we have to do a small incision, take the magnet, and the patient can be subjected to an MRI, and when the patient comes back, we put the magnet in. It involves a small nick of procedure, I would say. It's not really a big procedure, and can be done under local anesthesia as and when required.
Are there any social welfare schemes for cochlear implantation?
Yes, there are social welfare schemes. In fact, the government of India, the central government, has what is called the EDIP scheme, where below poverty line patients are implanted free of cost in EDIP recognized centers. And I'm proud to say that Apollo Spectra is one of the EDIP recognized centers, and I am a head of that center. So we will be able to offer free cochlear implants provided by the government, and this is an end-to-end free program where the patient doesn't have to spend anything, provided the criteria for free implantation is met. And one of the most important criteria is that the child should be a part of a below poverty line family. And there are a few other criteria as well which can be enumerated when the patient visits us. So this is a central government program. State governments also have programs. There are several state governments with state government aided programs, and in Karnataka we have a program under the Arogya Bhagya scheme, where the Honorable Chief Minister has provided for close to 500 implants per year to be done free of cost. This was not the case before. Earlier the implants had to be done only in the government hospital, but now the issue has been dealt with, and all private institutions too are eligible to do cochlear implantation under the state government Arogya Bhagya scheme. And that's a great, I would say, milestone in the history of treatment of programs, and I compliment the current Chief Minister for having taken this up and provided for a much needed reform as far as the state government cochlear implant program is concerned.
Thank you, sir, for your inputs.
Thank you.